tight agenda, so I'm going to keep us moving today if we can, partly because it's so cold and I'm freezing here, so I need to keep moving around. But there are a few things I wanted to just touch base with people and tell people about some of the great things that have been going on in the last few months. Notwithstanding, I've just heard our very own King do the opening presentation to COP, which I have to say was pretty inspiring stuff. So if you didn't hear it, it's well worth going back to hear some of the challenges he's put in front of COP28 this very morning, which is really good. So the first thing I wanted to just flag up to people was the now quite high profile conference that's been going on virtually on people, planet and quality improvement. We're supporting that, John, as the Institute, I know, and we had a fantastic week of various colleagues from mainly healthcare, but also I know Hannah was there. There were some manufacturers there giving their short presentations. Now, all of those are online, and I hope, Jade, we might be able to give people a link back to their website so they can go and relook at some of the cases, the studies that people put together, but some of the really inspiring presentations. And for me, although they were dotted throughout a week and I couldn't get to everything, you actually got a sense this year that it was gaining some momentum. There are a lot more people very excited about the work that they were doing, particularly in healthcare. And next year, Lorna, we're going to take them by storm with social care as well. So we'll let them have their place, but we'll move on for next year. So I'm going to just then move on, if I may, to just a little bit of feedback to the fantastic event I was invited to speak at in Milan last month. And Sylvia, your organisation, Axological, was able to host this event. And we're going to hear a little bit more about it. But I thought what would be really good, first of all, was to just play just a 5-minute video, just to give a context. And then maybe, Sylvia, you and I could have a conversation about the work that you've been doing and the conference in Milan. So thanks, Jade. I wonder if you could just run that video for us. This just talks about the team and the work that they've been doing. And you'll be glad it's not in Italian, it's in English.
In Axologico crediamo che una sanità più sostenibile inizi con scelte personali e professionali. Ogni piccolo gesto di responsabilità e attenzione va nella direzione di prevenire e ridurre gli elevati impatti ambientali legati alle attività sanitarie. Una sanità più attenta all'utilizzo delle risorse e all'incentivazione di comportamenti sostenibili dei dipendenti, più consapevole rispetto alle modalità con cui eroga le prestazioni, è anche una sanità migliore dal punto di vista clinico. Giovanni sta lavorando per ridurre l'impatto ambientale dei rifiuti generati nelle sale operatorie. Diversi studi stimano che questi rifiuti speciali costituiscano fino al 30% del totale dei rifiuti ospedalieri.
Non tutto il materiale che viene utilizzato negli interventi chirurgici è effettivamente infetto e potenzialmente pericoloso. Quindi un primo obiettivo della nostra azione è semplicemente non contaminare quello che può non essere contaminato e in questo modo avere del materiale che poi successivamente può essere differenziato tra i rifiuti ordinari. Il secondo passaggio è quello di ridurre il materiale in eccesso, costituendo dei kit specifici per le singole procedure ed evitando gli sprechi. Per questo obiettivo naturalmente abbiamo bisogno della collaborazione di tutto lo staff e dei fornitori.
Anche Silvia sta cercando nuovi modi per ridurre i rifiuti speciali fino al 50%. Il suo gruppo di lavoro si sta concentrando su 2 sedi in particolare, il grande laboratorio di analisi a Cusano Milanino e le sale operatorie di Capitanio in centro a Milano.
In Axologico stiamo testando 2 diverse modalità di intervento per ridurre il volume dei rifiuti speciali prodotti a valle dei processi. La prima modalità di intervento è di tipo gestionale, quindi intervenendo sul personale attraverso mirate procedure di formazione e anche con processi di controllo e di monitoraggio nel tempo. mentre la seconda strategia è quella di valutare tecnologie che permettano di ridurre il volume dei rifiuti prodotti e di migliorarne la composizione chimico-fisica in modo da migliorarne la recuperabilità a valle. Ci aspettiamo importanti miglioramenti in termini di risultati sia per l'impatto ambientale prodotto sia in termini economici.
Francesca si occupa della riduzione dei rifiuti urbani. Il suo obiettivo è quello di ridurre il volume dei rifiuti indifferenziati prodotti dalle strutture di Axologico.
Stiamo lavorando per ridurre la produzione di rifiuti urbani all'interno delle nostre sedi di Axologico. In particolare abbiamo come obiettivo di ridurre del 20% la produzione di sacchi di indifferenziata. È un obiettivo ambizioso, ma sappiamo che potrà essere possibile grazie al coinvolgimento di tutte le persone all'interno della sede Axologico. Intendiamo raggiungere i nostri obiettivi attraverso l'introduzione di cestini dedicati alla raccolta differenziata, in particolare nelle aree dell'accettazione delle mense e in tutti i nostri uffici. Abbiamo anche l'intenzione di installare erogatori di acqua in diverse sedi per aiutare a ridurre la produzione di plastica. Anche questa attenzione fa parte del nostro lavoro.
Erika si occupa di sensibilizzare il personale sulla sostenibilità ambientale attraverso iniziative di formazione e divulgazione per aiutare il personale a comprendere l'importanza delle loro azioni quotidiane.
Siamo convinti che con la giusta formazione e sensibilizzazione si possa fare una grande differenza. Per questo stiamo collaborando con la direzione Marketing e Comunicazione a progetti che aumentino la consapevolezza sul tema della sostenibilità ambientale ed incentivino comportamenti virtuosi sul luogo di lavoro e nella vita quotidiana.
In pochi mesi dal suo lancio, il progetto Noi siamo l'ambiente ha visto l'adesione volontaria di numerosi professionisti. Nell'ottobre del 2023 il Green Team di Axologico conta 32 persone provenienti da 12 dipartimenti diversi e sono decine le persone coinvolte su tante iniziative in corso o in fase di lancio. Isabella, ad esempio, sta costruendo partnership con enti pubblici e privati in Italia e in Europa per limitare le emissioni di CO2 e l'inquinamento dell'ecosistema sanitario e sta lavorando per rendere i nostri eventi più sostenibili. Matteo sta lavorando per ridurre il consumo energetico, introducendo politiche e pratiche di consumo responsabile che durino nel tempo. E Gabriele sta lavorando a un piano degli spostamenti casa-lavoro per rendere più sostenibile la mobilità dei dipendenti e ridurre l'impatto sul traffico cittadino. Come dice il nostro slogan, noi siamo l'ambiente. Ogni scelta che facciamo, ogni azione che intraprendiamo lascia un segno e noi scegliamo di fare la differenza.
Wow, thank you so much, Sylvia. That's a really inspiring little presentation there. You must be very proud watching that. And thank you so much for joining us. Sylvia, I wanted to ask you a little bit, if I may, about the sustainable behaviours amongst staff that you're promoting. I love your strapline, "We are the environment." I think we could all take that away today. But Sylvia, how do you manage to engage staff? How have you found staff have been engaged and interested in this agenda?
From the beginning of this project, it was an idea of Isabella. At the beginning, we started talking through the organization with the directors or responsible of all areas. And last year, there was a meeting in Romania where we have two facilities. So we could visit one facility, and there was a meeting between all the directors and responsible of Axological. And in that moment, it was launched the project or the idea just to have try to engage people, because I think the most important thing and the most difficult is to start with the project and start with the idea and to have as many people as possible on board on this project.
And so we had the first meeting, yes, in Romania. At the end of this meeting, we had a presentation of Healthcare Without Harm that we had just joined, I think 1 month before, because we asked to join Healthcare Without Harm net, the Green Hospital net, in June 2022. And so we had just joined the Green Hospital net, and then we had this meeting. At the end of the meeting, there was questions for attendance, and this attendance had to say if they were interested in joining the project as a coordinator or as a participant or not at all. Because I think if it is spontaneous, it's better, not forced at the beginning at least. And so we had 8 people, no less, I think 6 or 7 people were available to be a coordinator, and I am one of them.
Yeah.
And then we started with okay, the first, I think at the beginning we were at least 20-25 people, more or less. And then we had a newsletter in our organization at the beginning of the project. We started with the first presentation in the organization with the responsible in the end of last year. And then we had a sort of call to action for nurses and doctors involved in surgery, especially in surgery, because we produce many waste there. And so at the end, we had other participants that added the project. And so now we are more or less 35. Also during because we organize a welcome day every 3 months. Obviously, as a human resource office, organize a welcome day every 3 months, and in that moment they explain that we have a green team and we have many projects on environment involved in sustainability, and so it is a good opportunity to retain people and also to explain how they can join if they want, they can join the project.
Fantastic.
So
fantastic. So Sylvia, I'll see if other people have questions in a moment, but I just have one. Which project that you've been working on are you most proud of, that you think has been the best project?
Okay, in Axological, I'm a health, safety and environment manager as a role, a main role. So I'm involved in reducing waste, but at the end of after the processes, because we have this project is split in 2. So the first part, so before, so reduce before the processes. In that part is involved the medical and doctors. Perego was talking in the video. He's mainly involved in that project because obviously we have to start from the medical procedures and try to reduce material that you use in surgery or that you need to buy fundamentally. But obviously you produce, you must produce the waste. You can't avoid it. And so I'm involved at the end of the process after it. And it's because we have not only a hospital, but we have a big lab in Cusano Milanino, very close to Milan. And we produce more or less 1,000 liters per day of waste. And so it's a big amount. It's the results of analytics, results, blood analysis, and so on. And so we have it could be an opportunity to reduce, but also try to treat on site this kind of waste. So I'm involved in this project as we were in the lab, in the video, we were in the lab of Cusano Milanino. And there is another project, but it's not so I'm more involved in Cusano. The other one, it could be in the future, I think next year or later, is a machine for sterilization of infectious waste. So you can treat on site solid infectious waste, and at the end you can dispose them by public service as urban waste.
Fantastic.
So this is another project, but we had to meet the public company involved in the collection of waste. So it's
Sylvia, that's fantastic. Thank you. So those are exciting projects. John, you had a question. Would you like to ask that?
Yeah, I wondered if Sylvia has any target for reducing carbon emissions, and how is she measuring progress?
No, not in this moment, because we have to measure before. But we have a target on reducing the quantity of liquid waste with this technology. We can reduce 96% of volume. This is the target, and it's a very, very good objective, I think, a good target. Obviously, we had just an experiment on lab in this moment, pilot test, a very small pilot test. So with the company that will build this plant for us. So the small pilot test was very good with the mix of liquid waste. All the liquid waste have the same characteristic in so hazard and also in EER number. So this is the point. Otherwise, you cannot mix them. So we can mix them and have a treatment. The treatment is by a plant evaporator. The evaporator strip out the water fundamentally, and at the end, so you will have only a very condensed waste, but at the end you can reduce, the movement of transportation for the waste, and also you can just have water, clean water that you can put in the pipes, and so that's it. Yes.
And I think, John, it's different in Italy, because at the moment, Sylvia, you're not required by the government to have a green plan. So they've gone to where the issues are rather than starting with a carbon footprint. There aren't many people doing this work, Sylvia, yet, are there?
Yes, but it's because Axological is a foundation. So not because in Italy it's mandatory for as in all of Europe for big company, listed company, and so on for next years, and then there will be a sort of as we can say step by step. All big companies and listed companies will be will impact with this. But no, not Axological, it's not mandatory for us because we are a foundation. But anyway, you cannot ignore this opportunity, because all our competitors will be involved in carbon footprint. And
absolutely, fantastic. Susie, I think you have one other question for Sylvia. Would you like to ask us?
Sure. Hi, Sylvia. Thank you for that. It was really interesting. So I work for a national organisation in England that kind of brings clinical leaders together. I'm not a clinician, but part of what we're trying to do at the moment is trying to think about how do we get the sustainability, the green agenda, away from being kind of a niche or specific piece of programme or projects. How do we embed it into everything we do? So I'm just wondering, is there anything you've done around culture, behavioural, social movement within your organisation that takes it away from being project focused and more into this is just how we do things?
Really, we started from what we have done, what we want to do. So from where we're coming from and where we want to go. It's not easy. Really, the difficulties are related to the time that you have to consuming of these activities. So if you put them in your agenda as a part of your work and not a special work, but it is your work, it is the best solution, I think. It is necessary to involve as many offices as possible. The culture, obviously the directors, the general directors, otherwise it is impossible, I think, to go on, because you need budget, you need money to involve, to develop. At the beginning you can start just with the ideas and with just improve what you've done, what you do every day. You can improve it, obviously, but you need a map, you need to calculate carbon footprint at the end. I hope that we will do it closely. So for example, I'm now in this moment, we are involved in a group in Milan. It is called Axological, which is an organization of different companies working in Lombardy, the region where we are. And in Axological, there is a sustainability group that is working on for the next year for a tool that permits to calculate carbon footprint, at least direct impact, not indirect. It's difficult, but it's something that we can use, for example, just to start and try to have a quantity of CO2 that we emit. Yes, I think it's necessary, because the culture is something that you can construct step by step, but you need someone that can give you the way. I think.
Sylvia, thank you. Let me add to that, Susie. I think maybe Sylvia's underplaying the work that they've been doing, because there are two interesting things for me about this organization. Firstly, they put their green work under the marketing and communication team, which definitely played to the embedding and the cultural issue you've raised. We probably do exactly as you're describing, Susie, have little projects that come from champions and they're very excited about it, but we don't necessarily shout too much about it and join up. So one thing they did was to put it into marketing and communication. You then sold it, Sylvia, and the reason I linked in with you is because they linked into a bigger hospital network. So the Green Hospital Network that Sylvia spoke about, coordinated by Healthcare Without Harm, is a very powerful way to bring people together. And we're all dealing with the same things. It's just quite interesting to hear it in a different language from somebody else in a different place. But Healthcare Without Harm they facilitate that, bring people together. And then finally, Sylvia, one way you've really managed to begin to embed this was in your event in Milan. You had well over 150 people were in the room, came from very wide group, clinicians, non-clinicians. There were companies in the room, and it's the first time, apart from our meeting, where I've seen suppliers to healthcare actually in the room alongside clinicians. And that was meant for a very powerful conversation that we had. So that was really interesting. So I think you do try and embed it. I think the fact that you've got videos that you can share, it starts to chip away at this is something that's really important.
Yes, something that I would like to implement for next year. It's a net between Italian hospital for example, chemical substances.
Yeah.
How you manage chemical substances in our facilities, and perhaps sharing best practice.
Yeah. It's always great to learn from others, isn't it? So Sylvia, thank you so much. I hope that was inspiring for people to hear, and great to hear about your fantastic work, and good luck with it. I know that it's early for you to start on that journey, but we were just keen to get you along so we could hear from you. And thank you so much for your time today. You're more than welcome to stay with us, or you may drop off the line. I know you have another meeting you told me you were needing to go to, but welcome to.
Hour. So if you want, I can join.
You're welcome.
For a little bit.
You're welcome to stay with us, and if there are any other questions, do let us know what those are. So, thank you very much, and let's move on if we may, because we have a couple of other things to talk about today. And one of the things is the feedback from our own Greener Care Dragon's Den that I managed to link into a tiny bit on yet another train journey, John, but I wonder whether you'd like to give us a little bit of feedback from that.
Only it was really refreshing. I mean, it was a bit of out on a limb to try to do it. And those of you who don't know what on earth we're talking about, we do periodic Dragon's Den events where we encourage supply side people to present innovative ideas on particular themes. And we have a kind of a panel of Dragon experts to appraise the technologies and say whether they would invest in them and that kind of stuff. So it does have a bit of a wink to the BBC Dragon's Den series. But I thought it was fantastic, thoroughly interesting. We had Autumna there who really, I know they are partners of the Institute, but the work that they're doing now on environmental sustainability for the social care sector, I think is absolutely magnificent. And actually, I just enjoyed the whole event, Elaine. I don't really have a huge much more to add than that. If we're going to address carbon reduction and environmental sustainability successfully, as Sylvia has already made manifest, then we have to invest in new technology solutions, and we've got to find the right ones that can deliver measurable impact. So I suspect part of the problem is separating the wheat from the chaff, and making sure that we don't entertain the sort of snake oil salespeople, but instead find technologies that can have a measurable and visible impact. And I was really thrilled with the way that the Dragon's Den event addressed that. And yeah, we didn't have any snake oil, let's put it that way.
No snake oil. No, fantastic. And John, just to build on what you're saying there, I think it's, for me, increasingly important, and I did tuck this in at the end of the agenda, that we do engage with manufacturers, producers and suppliers to healthcare, because they will have some of the solutions, but they also will adapt to what their customers are asking for. So when I was speaking out in Milan, it was around plastics in healthcare and the chemicals in plastics and the impact of those chemicals. And it was very helpful to have some of the producers in the audience who were telling their own stories about how they were not only greening their own parts of an organization, PICA, for example, Philips, one of the radiology organizations, and the work they were doing internally, but also their contract with their customers to try and provide renewables to them as a new product, which was very powerful, I thought, to start to hear the suppliers, rather than just selling us stuff, thinking about what happens to that stuff at the end and how they felt a responsibility for it. So it was really helpful, and I'd be very keen to continue some of those Dragon's Den type conversations with suppliers, manufacturers.
You can be sure there'll be more.
There'll be more.
You know,
Great.
I suspect, you know, just to kind of throw this out there, I suspect that part of the challenge for us when we're looking at technologies is the origin of the materials that we're using, the sustainability of the materials that we're using in technological solutions. Because quite rightly, there is a debate and a discussion about, look, you know, where the provenance of these materials in terms of where they're being made and so on, and what power and energy they're requiring in order to be manufactured is something that perhaps we need to spend a little bit more time considering. Because, you know, with everything that is made in some of the developing countries or places like China, you know, unsurprisingly, they would turn and say, well, we have to develop, you know, coal-fired power stations and so on to fulfill the energy requirements to make these things. So I think we have to address this business of provenance and genuine sustainability for the materials that we're using to make these new technologies from.
I think that's very well said, John. And frankly, we don't, particularly in healthcare, spend an awful lot of time thinking about where this stuff comes from, let alone what it's made of. And I have heard a number of times recently, and it's a very powerful argument, which is that we're not going to be able to recycle our way out of this issue. So it will be around sources, new materials, new technology, rather than thinking, oh, it'll be fine, we'll just be able to put it all into different recycle boxes and it'll all be fine. We will not be able to recycle our way out of this issue. So, well,
I look at your, you know, you were talking earlier on about your brand new heat pump exchanger that you're having installed.
Yeah.
You know, where was that made, for example? From what materials? How many of them are recyclable? How many of them are renewable? And I'm absolutely at pains to point out that implies no criticism of you whatsoever. But, you know, we're not very good at, when we're putting these things in our homes or in our businesses, just being able to easily assess, okay, how have they been made? What from? Where?
Yeah. And I think it's a different conversation. So my poor builders here today are sick of me asking those sorts of questions. You know, can you recycle a solar panel? They went, I've no idea, but they've been off and found out. And they've come back and told me that's possible. Now, you know, unless we know the questions to ask, we won't ask the questions, and then we'll never push industry into thinking differently. So I think it is circular. But frankly, and I've said it a number of times on these calls, I didn't know even the questions to ask. So the more people we talk to, the more we find out. To be honest, the more things we can ask of them. So
there we are. Thank you. That's it for me on the Dragon's Den stuff anyway.
Great, John. Thank you so much. So let's move on to Lorna, who, thank you so much for joining us, Lorna. So we've also been looking at the work that's been happening in healthcare, but then thinking about how we can support the green ambitions of care homes. And Lorna, I wondered if you could just describe a little bit about some of the work that we've been trying to do and some of the problems that you've been facing in trying to do this.
Yeah, no, happy to. For those that don't know me, so I'm a care home provider based in Devon, small residential home, 30-bed, elderly dementia. And I'm also sustainability lead for our local care home association. I did a master's as well in sustainable development, so it's a personal interest of mine and a passion. So I've been on a bit of a mission over the last few years of, okay, so how do you measure your carbon footprint and what can you do about it? The social care sector, we are behind NHS, but in terms of, I guess, how we go about it, we're not a united front. We're a fragmented sector, all different shapes and sizes. You've got, you know, not just care homes, domiciliary care, personal care. You know, it's quite a complicated, complex sector. So my journey was really trying to start looking at, I know I need to do something, but I don't know the questions to ask. I don't know how to start. And I came across a project which was being run, encouraging just general businesses, not just care. And they would come in, measure your carbon footprint for free. It was actually through Southwest Manufacturing Advisory Service. And they would then analyze your data and look at what could you do. As I learned more about it, I realized this was only what they call scope 1, scope 2. So really for us, that's about our electricity and our gas and our vehicles. And yes, it was linked to the UN and FCCC pledge, which was great. And it came with an action plan, which was fabulous. And then the next year I went back onto the tool that they used, and I found out I needed to pay 700 quid to access the tool. And I didn't really understand the tool because actually they'd plugged all the data in. So I kind of went, oh, this isn't as easy as I thought. And as I learned more about it and realized that, in fact, a lot of my emissions will be out of my supply chain, actually, is that going to be enough? So to cut a very long story short, I've worked my way through various tools and found that when I go back the next year, they tend to have moved, or they are now, I've got to pay for them, and I'm not sure they're done in the same way. So I'm not sure if I'm comparing a year on year, sort of apples to pears, if you know what I mean, that it's not giving me a proper benchmark. And I don't really understand what's going in behind it, which led to us having a conversation to say, you know what care homes really need? We really need a simple, easy to use tool that is free at the point of purchase, that isn't going to be monetized, no snake oil merchants involved, and that it's layered so that you can do it at a very simple level, or you could go more complex if you want to. So that's the idea behind creating a pilot of care homes that will create and mimic what has happened actually with a tool called the GP tool. So there is in the market something called a GP tool. It's free. And the person that developed that tool, we're now in collaboration with and having conversations to say, can we mimic this tool, but make it in care home specific language? And actually, our way of purchasing is different to GPs. You know, our profile of business is different to GPs. He's really keen to get involved. So what we're hoping to do is try and attract a small amount of funding to create a tool, a beta level tool that would then be able to test and actually get care homes on the journey to being able to measure their carbon footprint. That's not to say they don't do things in the meantime. And we've got sort of top tips, and we do stuff in the newsletter, and we try and promote sustainability and the you know, small steps that can be taken. But this is work in the back process that care homes would be able to rely on in the future. So that's in a nutshell. So yes, if anybody's got any idea where we can find a small pot of money for this, that would be fabulous.
Well, we'll be seeking out some pump pricing, Lorna. But I think for me, it's really, really exciting, really interesting, because that idea of having something that is available and free at the point of care for you to be able to use. Why wouldn't we do that if we could? So you own it, you can measure it. And one of the things we were concerned about was you didn't want to be handing over cash for just an answer. You wanted to be able to see what the workings out were behind the answer, didn't you?
Yes, yeah. I think you need to understand it. I think because actually it's understanding actually how your actions will change that number. You know, so if you're purchasing different types of things, And that comes down to, actually, Sylvia was talking, and I think the point is getting that staff engagement, because actually they're the ones that will make choices, or that how things are used.
Yeah.
And actually operationally, how do we use stuff, and do we need to use it that way? All kind of feeds into getting a more sustainable organisation, but we need a way of measuring it.
Fantastic. So that's really exciting work. Thank you, Lorna, so much for bringing that today. Are there any questions for Lorna on that? It doesn't look like, Lorna, so I think we'll just carry battling away, and we'll bring you something again to this group, and I'm sure it will be of a lot of interest to a lot of other care homes and owners. So thank you. Thanks, Lorna.
You're welcome.
Excellent. So we're ticking our way through this agenda really well today. So thank you. Let's move, if we can, to the Greener Care short course modules. So I've been doing some work myself on these modules, and we're pretty close to being able to get those uploaded, Jade. But I wanted to just explain how we now can have tried to reframe what we've previously been calling a Greener Care course into something that covers the triple planetary crisis in different modules. So the way I've structured it now is that there'd be an introductory module which gave people the fundamentals and the basics of the issues that we're trying to deal with here in this group. But then we focus down into the 3 areas which now come together as part of that triple planetary crisis, and look at them through the lens of both health and social care, both the impact we're having, but also some of the fantastic examples that we've collected and harvested over the last couple of years from colleagues who are taking action. And the 3 areas are around pollution, specifically around climate change, and the third one is the impact on nature and biodiversity. And you can't really be able to untangle those, so there is always some overlap on those 3 areas, but it started to fall into these 3 obvious areas when we were talking about pollution, the impact, as we've started to touch on already today from Italy, and we've heard from our own countries about the waste that healthcare creates and how you manage that and what you do with that, how you decontaminate around pollution, for example. Then the area around climate change, there's lots of work that we know people have already been doing to try and reduce their own carbon footprint. Thank you, Janet. I see both Janet and I've yet to work on Lorna, but her gonna, I hope, puts a couple of little videos in for people's perspective from a health and a care perspective of why this is important and why this is important now. And then the last area, we really need to reconnect, and in a lot of our meetings we've talked about the impact of nature, because we recognize the impact of some of our polluting ways, or the impact we have on climate, on nature and biodiversity. So we thought we should give that a specific area and a call to action again to tie back into nature. And yes, absolutely, that behavioural change, that green prescribing, Susie, all of those sorts of areas would be in that space which we wanted to protect. So we're pretty close to having that. We will have it as a course that people can do in sort of half an hour, 20-minute blocks with questions that can be answered at the end, just so that there's a way to hopefully be able to certificate people's basic carbon literacy, but also now a wider, more diverse understanding of the impact on pollution, climate change, and those impacts on nature. So watch this space. We'll do the last bit of work, and hopefully we can test those out with people I might call for your individual help to have a look at some of those modules before we go live, but they'll be quite dynamic, and as the situation's changing, of course, we'll be adding more information into those modules without overwhelming people. So I'll pause there to see if there are any questions on that area at all. No? Excellent. Good, good. And then I mentioned the last couple of things I had were really just to... Bye, Sylvia. Thank you so much.
Bye.
Good luck. Good to see you. So the last couple of areas before we just open up the floor for any other interesting things were about the engagement of manufacturers and suppliers. So again, I think the more engagement, the more conversations we can have, the more we can understand their perspective on the fact that, of course, they're there as businesses to make a profit, but we want them to leave the smallest footprint they possibly can. So I think we may be looking, John, for more engagement than we've got even at the moment around some of our suppliers, and hearing some of the people that work very closely with health and care at the moment on what their perspectives might be. So I think I'll be looking for more people to come and talk with us at this group from their own perspectives. I've got my eyes on a couple of them already. And then the final thing, which really gives a feed into the, and a plug for the next meeting, Jade, which I saw you put in the chat there as a financing Greener Care, because this is a new area. It is tricky to find some resources for it, but there has been, although the date's closed now, for the small business research investment, which has been specifically for healthcare, Lorna. So you know I'm frustrated it's all to do with healthcare, but it has been funding that's been put towards up to £100,000 for people to bid against to seek support for green initiatives under a couple of categories. Now, very clinically led. One of them was around changing clinical pathways. Another one was reducing the use of some materials in intensive care environments that were high volume. So it was very targeted, very specific, and hopefully we'll hear who's been successful early in the new year. But I use that just as one example, Jade, and I think we'll be looking for where are the other sources of funding to pump prime some of this work, or where can we join that up so we can actually get some of these manufacturers maybe to help us in some of the resourcing some of the solutions. So I think that would be very interesting. So I'm going to pause there. We're getting up to just past 10 to the hour, and see if there are any comments or questions or any fantastic things. I always give a chance at the end for if there have been any things that other members have heard that we'd like to hear about. Susie, do come in.
Thank you. I just want to say thank you, because this is my first attendance to this group. It's been really interesting. I'm doing some work nationally on how we can develop kind of a clinical and care leaders network specifically around sustainability. So that was part of the conversation I was having with Sylvia. How do we integrate that language more into in how we do things every day? So I'm linking in with NHS England. I've got a National Care Forum and the work that Lorna's doing, because I know that I don't think National Care Forum kind of brings the private sector so much into that. I think it's enough. So I'm just trying to figure out different ways of getting the national people that are really passionate about this together so we can make a real proper movement. So this group's going to be really helpful for that as well, because I want us to make a difference. I'm really passionate about sustainability. Right. I want us to talk about it from my NHS hat, around how it will deliver integrated care, how it will reduce health inequalities. Because I think if we use the kind of the current burning platform, it will start to get some movement. So it's just really a call to anyone that might be interested in helping me do something. That would be great. Really.
Well, you're more than welcome to join us here, but absolutely, I think one of the benefits of the Institute is how well it's networked, John. I think.
Well, I'm just going to say in half an hour, I've got a meeting with Vic Rayner from NCF. So
oh, brilliant.
Yeah. I'll mention that to Susan.
Yes, yeah, I think it was Vic I was in touch with, so that's great. Yeah, so I think it's just getting the message out there that it's here to stay. It's part of everything we do, and let's all work together to do something fabulous.
We love your passion, Susie. You're in the right place. Come back and play with us again. We'd love to see you again. Let me bring another passionate ambassador in. Janet, you're on a desert island today.
Yeah, that's Turkey. I just wanted to share that the trust actually is working with an innovation design company that's keen to partner with different organizations, of course, to look at innovating, on things that we already use. So like the inhalers, some other devices, basically medical and non-medical devices that we could improve in a sense and make more sustainable. So if there's any idea from anyone who wants to participate in that, let me know.
Okay, and is it a practical material thing like an inhaler, or I'm just thinking, Lorna, maybe they're interested in developing something to help us measure carbon footprints, for example, Janet?
Yeah, there are those as well that I'm working with that they're keen to develop how we can measure, particularly on scope 3, because that's the so I can get those together with us and with Lorna to maybe we could form some kind of a group just to look at that, because in fact just now, as before we have this meeting, I was just looking at how much carbon emission would a needle actually have, because we're trying to justify why we need to go into pre-filled syringes. So those kind of things, that level of details, we could certainly look at, and also like life cycle assessments and stuff like that. So yeah, definitely.
Fantastic. Well, we're keeping our eyes and ears open, Lorna, aren't we?
Yeah, absolutely.
Innovation. And John, just finally, one of the things we're really interested in talking about, and I know this will excite you, Janet, as well, is some of these ideas we're thinking of. We love your Greener Dragon's Den, but we'd like a green sand pit to play in, John. And we wondered whether the Institute would be interested in helping us. Lorna, what do you think with our sandpit ideas?
I think that's a great idea. I love the sandpit idea. Early development ideas. You have to have a sandpit, and you have to invite the right people to come and play in your sandpit. It's great.
Oh,
can I just pinch myself for a moment? I think I may be on the wrong call.
You're entirely on the right call. So this idea of trying, because we tend to all come across the same people and work in the same way and think in the same way, bringing in people that think completely differently into a sandpit with an issue to try and bounce around, creative ideas, is what we're exploring, John. So there we go. We'll just yeah, he's saying that's a great idea. I can
happy
tell
to help. Happy to help.
Thank you so much. Well, we'll think about explicitly what we want to play with in the sandpit, but we'll come back and watch that space, Lorna, if that's okay. Thank you. So we're nearly at the top of the hour. There's probably only time for me to ask Jade to tell us exactly when the next meeting is, Jade, if you wouldn't mind.
So the next meeting is on the 9th of February 2024. This is the last meeting of this group for 2023. We've achieved quite a lot as a group over the last 12 months and onwards and upwards for the new year. Our 9th of February meeting will be a roundtable discussion on how do we finance greener care. Charlotte and I are looking for speakers to join that panel discussion. It may be that you have experience in procurement. It may be that you're from a financing background. either yourself or colleagues are more than welcome to be participants in that roundtable discussion. And then we'll meet bi-monthly from the 9th of February. So every 2 months we will meet together as a group. But of course, there'll be lots of events in between that will be dedicated to the theme of being sustainable and reducing our carbon footprint. Over to you, Elaine, for closing. Thank you.
Jade, thank you. Fantastic. So hopefully we'll see everybody again on the 9th of February, but do keep in touch. You'll link into us. And I can say for the first time, Happy Christmas. See you next year. Thanks very much.